the ideal strategy for primary prevention is a population-wide strategy. When the intervention is applied across all population, whole population, regardless whether people have low, high risk, interested in prevention, not interested in prevention. I give you an example. Smoking cessation campaigns, quite successful in several developed countries. Not as successful as it should be, though, but it is one of the examples when smoking prevalence in the population started to decrease because of different strategies. First of all, taxation on cigarettes, increased taxation on cigarettes. That's the most effective strategy. And it's working. It's working. It's working wherever it was used. In New Zealand, in UK, United States, Western European countries, this strategy really effective. Smoking is one of the important risk factors for stroke and cardiovascular disease. So it has preventative effect. No one denies it, and it is the most cost-effective way. But what we have now, that strategy, population-wide strategy, is quite difficult to implement on the national level because of the huge lobbying from industry. That smoking industry, it took 50 years after the first evidence of unquestionable hazard of smoking came out from UK large cohort study of doctors. And then only I think in 2000 or close to 2000, the Surgeon General of the United States put a ban on smoking kind of campaigns. That was the first 50 years later. But other strategies like reducing salt consumption from processed food, not table salt. Table salt is very little contribution to the salt we intake. Processed food, bread in particular, or sugary drinks. Every public health physician, every, I would say, clinician knows the hazard of this excessive consumption of these products. And there are strategies in place, proven strategy, endorsed by the World Health Organization, you name it. Why government don't apply those strategies in practice? Lobbying. Huge industrial lobby, because for industry to implement this strategy costs billions of dollars. They don't want it. They're quite happy with the status quo and very difficult to change. And it's not to name other possible population-wide preventative strategies. Therefore, there is still no country in the world where these strategies are implemented in full at national level. So that's problem number one. And now a possible solution for that, which wasn't available even 15 years ago. It's just recently, 5 maybe years ago, it is digital technology, particularly smartphones. In developed countries, virtually all adult population, and to be exact, 92% of adults in developed countries have smartphones. In developing countries, the ownership of smartphones, of course, less, about 30 to 40%, but it's on the increase, on the constant increase. And that provides really unique opportunity. I would say new public health era of awareness, educating people about health problems, prevention, different aspects of improving health, because virtually all adult population can use it. And by the scale of the use, if most of the adult population, we use that technology for education, for prevention, healthy lifestyle, and so forth, it will almost be equivalent, not entirely, of course, but close to population-wide strategy, but because whole population is involved in prevention. And that is very unique, not to miss opportunity for us. And particularly because I'm dealing with stroke prevention, we recognized it about 8 years ago, and that's what we developed, the world's first Stroke Riskometer app. And it's free to download and use, and currently translated in 19 languages, available in native languages for 5.3 billion people. Use it right now. It's free.